Malaria remains a significant public health challenge in Ethiopia, affecting approximately 75% of the country's landmass, with around 69% of the population living in malaria-endemic areas, with cases continuing to be reported. In our previous video, we have described the situation briefly. If you haven't seen it yet, don't forget to check it out. It's in the I button. In today's video, we'll dive into the details of the situation and the efforts made by the government to tackle it. So, let's get started. Between January 1st and October 20th, 2024, Ethiopia reported 7 million malaria cases and 1,157 deaths, marking the highest number in 7 years. This year's surge is particularly alarming as malaria outbreaks have extended beyond typical peak periods. Laboratory tests confirm 95% of the cases, with Plasmodium falciparum responsible for over 2/3 of infections.
The highest burden is seen in 4 regions: Oromia, Amhara, Southwest and South Ethiopia, accounting for 81% of cases and 89% of deaths. The western part of the country, with its favorable conditions for malaria, is particularly affected. 222 high-burden districts, which make up just 20% of Ethiopia's total districts, account for over 75% of malaria cases, though 50 of these districts remain partially inaccessible due to ongoing conflicts.
Malaria continues to affect vulnerable populations, especially men, who make up 56% of outpatient cases, and children under 5, who account for 25% of inpatient admissions. The high movement of seasonal migrant workers, mostly adult males, into malaria-endemic areas is a contributing factor. As you may know, malaria is a life-threatening disease caused by parasites transmitted through the bites of infected female Anopheles mosquitoes. It can also spread through blood transfusions, organ transplants, or sharing contaminated needles. Additionally, it can be transmitted from mother to child during pregnancy or childbirth. There are 5 species of malaria parasites, but 2 of them, which are present in Ethiopia, pose the greatest concern. The first symptoms of malaria can be mild and mistaken for other illnesses, which makes early diagnosis difficult. If untreated, it can progress rapidly to severe illness or death within 24 hours.
Ethiopia has faced devastating malaria outbreaks throughout history, with major outbreaks occurring every 5 to 8 years. Despite significant progress in malaria control over the past 2 decades, including improved surveillance and effective interventions, the country has seen a resurgence since late 2021. The number of malaria cases has increased by approximately 75% each year, and more areas are now classified as malaria endemic. These trends highlight the ongoing threat of malaria, raising an important question: what is behind this sudden increase?
The growing trend in malaria cases can be attributed to several factors. A major contributor is the decline in vector control efforts, particularly due to ongoing conflicts in various regions. As of May 2024, over 3.3 million internally displaced persons are at higher risk due to the loss of malaria immunity, inadequate housing, and limited access to insecticidal nets, particularly in Oromia and Amhara.
Ethiopia's refugee population, over 1 million people, adds to the challenge. Many refugees live in the western lowlands, a malaria-endemic region. The situation is worsened by an underperforming surveillance system, which leads to delayed testing and treatment. The lack of resources and funding also hampers control efforts.
Additionally, the spread of Anopheles stephensi, a mosquito species that thrives in urban areas, has introduced new challenges in cities where malaria was previously rare. Climate anomalies like El Niño and La Niña, which impact weather patterns, further increase malaria transmission. Combined with ongoing conflict, food insecurity, and poor security, these factors raise the risk of severe outbreaks, particularly in remote areas. Ethiopia's neighboring countries also face malaria and other vector-borne disease outbreaks, complicating control efforts across the region.
The ongoing malaria outbreak in Ethiopia has led to a coordinated public health response, with the World Health Organization, WHO, playing a central role in supporting the Ministry of Health. The response is being coordinated through the Incident Management System, focusing on key interventions.
The Ministry of Health, supported by WHO and other partners, is managing the response through the establishment of national and regional malaria emergency operations centers. Weekly coordination meetings ensure alignment across regions. A critical part of the response is the provision of health supplies. WHO has dispatched over 256 metric tons of medical supplies, including malaria medicines and rapid test kits, worth over $1.4 million, to the most affected areas.
Additionally, WHO has deployed technical experts to the affected regions. Since January 2024, 8 experts have been sent to Oromia, Amhara, and Southwest regions to help manage the outbreak. WHO works closely with partners to ensure supplies reach their final destinations. However, challenges remain in mobilizing resources. Despite ongoing advocacy, there is still a significant funding gap, and the health system is under strain due to multiple emergencies. Issues such as displaced healthcare workers, damaged facilities, and limited access to conflict-affected areas have exacerbated the situation, leading to shortages of essential malaria diagnostic tools and treatments.
To summarize the situation, malaria continues to pose a significant public health challenge in Ethiopia, exacerbated by internal issues such as conflict, displacement, and weak health infrastructure, alongside external factors like climate change and regional outbreaks. The WHO recommended strategies such as effective vector control, preventive drugs, early diagnosis and treatment, and strengthened surveillance that are crucial to controlling the disease. However, the severity of the situation calls for substantial international support, ongoing funding, and a renewed commitment to malaria control. Only through these combined efforts can the devastating impact of malaria be reduced, especially among vulnerable populations. Do like, share, and subscribe.
Thanks for watching.